This is a very bad bill. It's going to cost 22 million people their health insurance, for which the government will save about $321 billion. There's an estimate from the Annals of Internal Medicine that for every patient, one patient will die for every million patient who lose their insurance. I'm sorry, 1,300. 1,300 for every 1 million, which means that 268,000 people will die over 10 years as a result of this legislation. It's wildly unpopular with the American people.
Jonathan, I would expect you would have the same reaction. And I think we should also say that Dr. Molina, that while you're not there anymore, Molina was a big provider of Medicaid and a big participant in Obamacare and beneficiary of it. But Jonathan, wanted to get your quick take on the Senate's version and what, I don't know if we know the specific details of what they're doing to amend it, but it is a moving target.
Yeah, it's a moving target, and much like the House bill, they're trying to move both right and left at the same time. Moving left is things like putting some money into helping with opioid addiction. But let's be clear, by the best estimates, just to replace the money they would take away for supporting opioid addicts, they would have to put 180 to 220 billion in, not the 45 billion they want to put in. And that doesn't account for the fact that we only treat 20% of opioid addicts in America today. And the Medicaid expansions were associated with a massive increase in effective treatment of opioid addicts. So instead of increasing that path, we're going to go backwards with this law. On the other hand, the big thing they're pushing right now is this Cruz amendment from the right, which would essentially split health insurance markets, allowing healthy people to buy skimpy plans at low prices and sticking sicker people in essentially high-risk pools. So they're trying to have it both ways, and you know, if the senators are on their toes, that won't happen.
Why not yet? I was going to ask about that, Jonathan. So you brought it up, but you didn't really answer. Why is that a bad idea?
It's a bad idea because, look, at the end of the day, there's one fundamental rule we all have to keep in mind. 80% of healthcare spending is done by 20% of the people. Those 20% of the people cannot afford to pay the 80% of healthcare costs. Healthcare is all about risk sharing. That's what Mr. Molina did. That's how he made money in his company. That's how insurers make money. It's risk sharing. So what Ted Cruz wants to do is essentially undo the risk sharing that we all enjoy. Those of us who employer-sponsored insurance, we enjoy the risk sharing from our coworkers. Those of us who have government insurance enjoy the risk sharing from the taxpayer. What the Cruz amendment would do is essentially undo that risk sharing, sticking sick people with bearing an unaffordable share of their health care costs.
Mr. Molina, something I don't hear a lot about these days is simply the idea of bending the cost curve on health care overall. It was certainly something that was aimed for with the ACA. It's not necessarily something that's come up that often, it would seem, at least in the debates going on in the Senate right now. I mean, are we ever going to actually figure out an effective way to actually start taking costs out of the system?
Well, unfortunately, this bill and the previous bill are about who pays for health care. The reason health insurance is so expensive is because health care costs are so high in this country, and we haven't done enough to address that issue. Frankly, if I were in the Senate, I would scrap this bill, I would convene a bipartisan group, and I would attack the fundamental problem of the high cost of health care. If you do that, insurance rates will come down, health insurance becomes more affordable, and we don't have this issue. But until we attack the root problem, we're going to constantly be revisiting this issue, and we're not going to come up with a good solution.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.